drug through Medicare. And everybody had to be enrolled in some kind of plans. The ones with Medicare and Medi-Cal, the low-income, the free insurance service, they were either automatically enrolled in a Medicare D plan, or somebody would help them to enroll into one. The ones who were automatically enrolled we still have those couple of company lists that serves Medi-Cal. It's called the benchmark plans. So they're low premium or no premium with a very low copay. I think $3 to $6 or something like that. That's for Medi-Cal, people with Medi-Cal. Some of them who have been automatically enrolled into one in 2006, they are rolled over every year automatically to another benchmark plan, okay? So the reason for that is, for example, AARP, Medicare Part D plan, they were one of the benchmark, one of the cheaper plans in 2010. 2011, they made a huge announcement saying that we are not going to be benchmark plans anymore. So what would happen if you are a Medi-Cal recipient who are under AARP drug plan? You were responsible for no premium and very low copay. 2011 January, you will be responsible for very high premium. Okay, so you have to disenroll yourself and then go into another benchmark plan. Okay, so do you understand that? Is there any question about that so far? No? Okay. That's Part D. This coming year, this is the list for Medicare Part D companies in 2011. In 2010, we ended with the 45 companies. That's a lot lower than when we started in 2006. Some Medicare Part D companies were opt out. They decided, okay, we're not going to do this anymore. We thought we were going to make a whole bunch of money, but it's just too much trouble. Okay, and some companies were kind of sanctioned. They were just forbidden to enroll any more people because they were not abiding by the contract they signed in the beginning. For example, this one company said that we will carry this kind of medication and we will charge this much. The client goes to the pharmacy and tries to buy her drug medication and finds out that they don't carry it anymore and they're not charging the price they said they would charge. And when we file a complaint to SMP, Senior Medicare Patrol, all these complaints are kind of saved up, okay, and then the companies get in trouble. So seniors' complaint is really, really important, okay? We just have to really, really call and be on top of when we were kind of just taken advantage of, okay? So these are the lists. I think it's less than 20 this year, but 5 of them are benchmark plan for Medi-Cal. We can discuss more about this, and I'm going to talk a little bit about the Medicare Part D changes through healthcare reform after I explain this Medicare programs. So Part C is, so when you have Medicare, it covers 80% of your services. So what happens to 20%, it should come out of your own pocket, which can be really, really big money, or you always have to kind of get ready, to pay that. So that it could be a lot of money. If you get hospitalized, then for 2 days, it could be like $10,000, and you have to come up with $2,000. That's a lot of money. So what happens is people will buy an insurance for your Medicare to cover the whole cost. Example is Kaiser, Senior Advantage, Secure Horizon, Blue Cross, Anthem Blue Cross, or HealthNet. Those plans are Medicare Advantage plans. It's called Part C. So that's Part C, okay? So people think, I don't have Part C. What is this? I have to get on Part C. If you have an insurance that supplements your Medicare. That's your Part C. People with Medi-Cal is their Part C, so they don't have to go out and buy separate Kaiser or, Secure Horizon, things like that. And a lot of immigrant seniors in our community do receive both, and some don't. That's why we have to let them know. I went out to a senior home facility and found out this one resident was paying $65 premium every month. She had her Medi-Cal. She enrolled herself in another Medicare Part C. So she was throwing away $65 every month. So, that's why we need to advise them not to do that. Okay. Oh, there's also Medigap plan. You can buy a Medicare Part C, Medicare Advantage Plan, to cover the whole Medicare, or just have your Medicare, which covers 80%, and then buy separate insurance for 20% of your Medicare. That's called a Medigap plan. Okay? That's the overview. And I did bring Medicare Advantage plans for Alameda County 2011 here. For those of you who need it. The reason why HICAP is in every county, I'm going back to the county issue, is this is list for Medicare Advantage plan for Alameda County. We have separate list for Contra Costa County. We have separate list for San Francisco. We have separate list for Santa Clara County. So if someone calls our office from Santa Clara County and asks, can you help me choose a Medicare Advantage plan? We cannot enroll them in this Alameda County one, right? So they have to be enrolled in Santa Clara County. Kaiser, Alameda County, let's say that person who has Kaiser in Alameda County moved to San Francisco. They have to switch over to San Francisco Kaiser, or it is chance for them to choose a different plans in San Francisco. Okay. When you move out of the service area, that's the time you can change. But you can only change once a year between November 15th through December 31st. And with healthcare reform next year, the duration of period to change is different. It will be October 15th through December 7th, right, for 2011. So that's one of the changes. In order to understand the immediate changes in healthcare reform, we have to understand donut hole. So donut hole is it has to do with the Part D, okay? Medicare Part D plan. Anybody who falls into donut hole in here? Nobody, right? So, okay. But I'll talk about it anyway. Donut hole is, state of your benefit. When beginning of January 1st, you buy your medication, okay? And then you accrue up to $2,800